Teenagers are now receiving the COVID vaccine in Hungary. The Prime Minister announced at the end of April that 16 to 18-year-olds will be able to receive the Pfizer jab after the final exams. Almost half of the age group, more than 90,000 young people, have already registered for the jab, for which they will need parental permission. Tamás is 17 years old. He decided to ask for the vaccine to protect his family. He believes this is the way back to a normal life.
I was looking forward to getting the vaccine. When it was first announced that my age group would be vaccinated, I started to hesitate whether I would ask for the vaccine or not. But a few weeks before they officially started the vaccination, I knew that yes, I would.
Bence doesn't want to bring the virus home either, which is why he asked for the vaccine. Many of his family members are still queuing up for the jab.
I cycle competitively, and for the sake of my family and friends, and for my own sake, I didn't want to catch it.
The virus is not indifferent to young people, according to a virologist, Miklós Rusvai. Post-COVID symptoms often appear months after the infection has passed, which is why Rusvai says it is important that younger people receive the vaccine.
6 to 11-year-olds are already being vaccinated in pilot groups. I believe that by autumn, when the next school year starts, all school-age children will be able to go to school vaccinated.
In Hungary, 6 vaccines are available. Besides Pfizer, BioNTech and Moderna vaccines, the jabs of AstraZeneca and Johnson & Johnson are also available, as well as China's Sinopharm and Russia's Sputnik V. So far, almost 4.5 million people have received their first dose. And according to government plans, by mid-June, those who accept only Western jabs can be vaccinated. Olivia Harangozó, Euronews, Budapest.
Well, Daniel Altman is Professor of Immunology at Imperial College London, and he joins me now from the UK. Good to speak to you again on the programme. Now, Hungary is leading the way in Europe with this. Should other countries be following suit and looking to vaccinate teenagers?
I think they probably should, and they probably will. I think your piece covered the territory very well. That though we thought at the beginning quite rightly that we had to target, the very at-risk older age groups, in the end, if we want to really be rid of this pandemic and, move around, get back to schools properly, not be prey to more and more waves, we need full coverage. So this is the way to go.
Should this be more of a priority now? There's obviously lots of talk of vaccine passports and summer travel, but we're not talking a lot about vaccinating children and teenagers.
Well, the first thing to say is as your piece mentioned, that although children and teenagers aren't the key at-risk group, they certainly are at risk, increasingly at risk in a way with the variants, including from long COVID. And, picture the situation if we're trying to evolve some kind of modus operandi for vaccine passports, and you have families booking to travel and mum and dad are vaccinated, but your 18-year-old, 16-year-old and 14-year-old aren't, and yet they can all, get infected and transmit. That's a very confusing future for us.
Other countries such as the US are now looking to vaccinate 12-year-olds. Is that something we should consider?
I can't see any reason why not. As we move through the phases of this pandemic, one of the things we're all trying to crystal ball gaze about is, what our relationship with this virus looks like over the next 1 or 5 or 10 years. And we have difficult choices about whether we're going to kind of percolate it forever at a low level, or if we're really going to beat it down. And, the only way we can beat it down is if we don't have large sectors of our population, transmitting virus between themselves in schools and colleges.